Hello, everybody. This is your instructor for this Business 121 course, James Topey. Today, we have finally made it to our final lecture of this spring 2022 semester. I hope all of you enjoyed this semester, enjoyed the material that you learned. There's a lot of useful information in this class. And for some of you that go on to maybe your four-year degree, you'll get into more business law. But if you're just going your associate's degree, this was your one time to kind of get exposed to how business and law kind of interrelate and work together. As you can see, law plays a crucial role in almost every aspect of business. How businesses are built, how businesses grow, how they sell and interact with customers and the environment around them is all governed by the law. And so on Thursday, I'll do a final short discussion that quickly goes over the final and some other closing information. But let's get started with chapter 38 here. And I know you guys are anxious to never hear my voice again. So let's get started. Healthcare law. As you can imagine, folks, healthcare law is becoming, it's always been very important in human history, right? Your health is always an important, crucial part of everything that we do, right? I mean, without health, what do you really have? You could talk about your aspirations and dreams. You could talk about possessions. You could talk about love. You could talk about hate. But without your health, you truly have nothing. So healthcare laws, federal, state, local laws, regulations, and judicial decisions govern legal relationships of healthcare participants to one another. So obviously, we're talking about patients, physicians, nurses, CNAs, you name it, healthcare insurers, and the government all go in together and kind of create healthcare law. And of course, when we're talking about this, we're talking about administrative law. And I know we keep coming back to administrative law. Almost every aspect that we discuss in this textbook, we come back to administrative law. And just like many other aspects of our life, administrative law plays a huge role in healthcare law. So obviously, federal, state, and local administrative agencies oversee and regulate manner in which healthcare delivered by providers and ways healthcare services covered by insurers. When it comes to contract law, when we had, I believe that was chapter 6, when a patient consults with a physician, the parties enter a legally binding contract. When an individual or employer procures insurance policies covering medical treatments, a contract is created. Medical malpractice, when physician or other healthcare provider acts negligently, patient may sue for malpractice, which is tort law. So, and we did also, I believe that's chapter 4, where we discussed tort law. So these kind of three aspects of law play a role in healthcare law: administrative, contract, and of course, medical malpractice. So advance directive, legal document expressing a person's wishes regarding their healthcare if they become incapacitated or permanently unconscious without hope of recovery. So probably most of you are too young to remember a lady, I believe her name was Terry Schiavo in Florida. And she was, basically a vegetable. And if you don't know what that is, that's somebody who's unconscious, never going to wake up, and being kept alive by equipment and other medical practices. And, it became a big legal fight. And I believe it was in Florida again about whether she should be, removed from the machines and allowed to expire, or was it, the mandate of any medical physician or practitioner, if you will, to keep her alive. Kind of that first kind of oath of being a physician is first do no harm, right? So how can you allow someone to expire? But in these states, when you're basically, there's no hope left, you're incapacitated, never to regain consciousness again. Many people, and my mother, who's been a nurse for 40 years, feels that way as well. She's like, always tells me, if I'm ever, a vegetable, let me go. Don't let me lay in that state. And I don't know how you guys feel, but, advanced directive allows you to kind of discover, or how you can manage that if that happens to you, right? So requirements for drafting and executing vary from state to state. I'm not sure what that could be here in South Carolina. I'm sure it might be, obviously an attorney and possibly a physician must be, a part of the document. In general, individual must demonstrate competency and sign directive in presence of witnesses. Directive takes effect when an individual becomes incapable of making treatment decisions. Some states require be confirmed by at least 2 licensed physicians. And again, what we've discovered in this class that although the U.S. Kind of has federal law as one kind of principal law, everything kind of varies from state to state. Almost every facet of law will vary depending on the state that you're in. Directive does not expire but becomes invalid only when the individual changes it or issues replacement directive. So again, an advancement directive, legal document expressing the person's wishes regarding their health care if they become incapacitated or permanently unconscious without hope of recovery. I would imagine many of us would just say, look, take me off the machines, let me go on, to that next part of existence, whatever that might be, if it's nothing. All right, so two most commonly used advanced directives are the living will and durable power of attorney for healthcare. I know we've all heard of these. Let's dig into them real quickly. So the living will, and again, this is some of this we know about, but let's go over it anyway. A legal document in which a person directs their physician and or health proxy to forego certain extraordinary medical procedures if the person is dying or permanently unconscious. So, obviously a will covers your assets, where you want your high school ring to go, what child, or who do you want your house to go to? Where do you want your land to go to? But obviously it involves, the living will specifically involves, your healthcare decisions if you are, dying of a disease or unconscious, permanently unconscious. Must be made following precise requirements of applicable state law in order to be valid. And obviously, if you want to make it valid, just make sure an attorney's there and the right practices are observed, and it obviously will be valid. And the purpose is to permit terminally ill patient to live or die with dignity. It's like my mother always says, don't let me suffer. Don't let me lie there, in a vegetative state, where I'm just a blob on the bed, as she always says to me, to lack of grace here, but that's what she says. Don't let me be a blob on the bed. Let me go. Protect physician or hospital from liability for sustaining or withdrawal from life support. So obviously, again, we go back to that Terry Schiavo case. The doctors or that local hospital did not want to let her, remove her from the machines that were keeping her alive, because they didn't want to be liable, right? Lawsuits from family members, you name it, could ensue. So when you have a living will, it insulates the physicians and the hospital from being any liability, right? And we've talked a lot about that word liability in this class as well. Durable power of attorney for healthcare, durable power of attorney for healthcare, legal document appointing an individual as agent with authority to make healthcare decisions on behalf of the principal in event principal becomes incompetent. So do not confuse these two, folks. They kind of work together as well, but do not confuse these two, okay? Again, this is, an agent is making these choices as opposed to the living will, where you line out your desires, right? So again, legal document appointing an individual as an agent with authority to make healthcare decisions on behalf of the principal in event principal becomes incompetent. Principal should take extraordinary care to appoint a capable and trusted individual as their attorney in fact. And it might even make sense to have, I'm sure you can have more than one agent, right? An agent could pass away, become incapacitated themselves, and not be able to carry out the durable power of attorney for healthcare. So there's probably ways you can appoint more than one agent. Agent must protect principal's best interests and not abuse their powers. Goes without saying, right? In event the principal regains ability to make decisions, agent may no longer act on principal's behalf. So again, do not confuse the two between the living will and the durable power of attorney for healthcare. Matters covered by advanced healthcare directives, living will and durable power of attorney will allow individuals to articulate their instructions for their medical care in event they develop the terminal medical condition, rendering them permanently unconscious. And I don't know about you guys, but this is, as you get older, I'm 44. Obviously, I'm not an old man, but I'm no spring chicken. And things like this come to your mind more and more as the older you get. And the one thing that you also see as the older you get, you experience death more. There was a time in my life that I knew no one close that had passed away. Now I've lost count of the people that I've known intimately that are no longer with us. And so that obviously, provokes thoughts in our own heads. How do I want to handle, do I need a living will? You start asking yourselves these questions. And this is certainly a question that you should ask yourself, because it is possible to unfortunately end up in a state where you are basically, for lack of better terms, a ward of the state. You're just, sitting in a hospital bed, no longer living and interacting with the people you love and care about. Depending on state law where individual resides, living will and durable power of attorney guides agents' decisions regarding healthcare treatment. And again, everything varies from state to state. So, but you don't need to know the particulars. So just kind of know that general maxim there. Matters covered by healthcare directives, examples of matters addressed in the living will administered by agent pursuant to durable power of attorney, autopsy, whether autopsy should be performed upon death. Some people, and a lot of people I've known, they don't want an autopsy. They're either religious beliefs, they do not want to have the body tampered with once they've passed away. They just want to go be put into the ground or whatever their ritual or burial or funeral ritual might be. Under state laws, there are circumstances in which autopsy must be performed regardless of wishes. And I'm sure this is in cases of capital crimes. You, the individual, might have, within your durable power of attorney or your living will, a request to not have an autopsy performed on you, assuming you die of natural causes or a disease of some kind, right? But if you're murdered or something of that nature, state laws will supersede and they'll perform the autopsy, which makes good sense, right? If you were murdered, you would want an autopsy to be performed to determine, how you were murdered or that just makes good sense. Burial and cremation, manner of disposition of remains. I've had many of my friends, I feel like the most of them that I've known that died, including my sister, were cremated. My mother wished to have that in her possession as opposed to, leaving my sister at in a grave at a gravesite. And I think that made her feel better. The fact that she could have some essence of my sister with her everywhere she was. To this day, that's still the case. And I'll tell you something morbid here. I've, for myself, I always kind of make a joke to my wife, throw me in a ditch. I promise I won't complain. Don't spend any money, cremate me, do whatever you want. But I have children and I always think, I don't think I could cremate them. In that discussion with my mother, I'm not so sure I could do that. That's it. Again, for those of you have children, those of you getting older in age, these are questions that, and discussions you must have. And obviously we have this on our license organ donation, wishes regarding organ donation. I think it's, it's kind of a good thing to do, philanthropy, if you will, to be an organ donor. I'm not sure what you guys are, but yeah, it's something that you can do to kind of help, in some ways you live on, right? When you think about it. So autopsy, burial and cremation, organ donation, all huge topics once somebody passes away. So I'm not sure how old a lot of you are. I think some of you are young, and things like health insurance, medical insurance are probably not as important to you as someone my age, but obviously there's tons of different types of healthcare coverage and insurance you can get for yourself. And there's a variety of ways that it's delivered and administered, right? So you've got community-based insurance is probably maybe the most common, major medical, commercial insurance, self-insurance, HMOs, health maintenance organizations, Medicare, and Medicaid. All right, let's roll up our sleeve, folks, and dig in. All right, so community-based insurance, medical insurance programs provided by Blue Cross and Blue Shield. Blue Cross and Blue Shield work together, and we're going to talk about how they, work together, if you will, towards the same end. Covers individuals, physicians, and hospital expenses. Patients generally pay a deductible, and we all know what a deductible is. That's a certain co-payment or whatever that you have to make, certain percentage of the deductible that you have to pay in order to get the service. Patient pays additional co-payment percentage in excess of deductible. Blue Shield covers costs for surgery, hospitalization, and other medical procedures, serves as reimbursement go-between for physician here. So let me see here, folks. Just give me 1 second here. Make sure I got my notes here ready together. All right, so let's see here. So while Blue Cross and Blue Shield are two separate legal entities providing insurance benefits in general, they coordinate their functions as follows, as I just said. So they work together to kind of to provide the necessary coverage that an individual might need. Let me read example 38.4 here that helps kind of highlights how they work together. And again, these names are tough in this book. I'm going to try to pronounce it correctly. If I don't, I apologize. Kalutsky experienced severe abdominal discomfort, and after visiting his family physician, was admitted to his local hospital for an appendectomy. Obviously, this is a removal of an appendix. His medical insurance plan with Blue Cross covered the doctor and hospital fees, and his medical insurance plan with Blue Shield covered the fees charged by his surgeon for the operation. So there you see how Blue Cross and Blue Shield cohabitate, if you will, together to provide the necessary insurance needs. All right, so now we talk about major medical, a type of insurance covering serious illness and lengthy hospitalizations. It serves as an umbrella or catastrophic policy, generally takes effect after Blue Cross Blue Shield and other related insurance benefits are exhausted. Some copays or co-insurance monies are paid by patient. So a lot of times when you have Blue Cross Blue Shield, people will have some sort of major medical insurance as well, which again serves that umbrella. When Blue Cross and Blue Shield runs out, your major medical insurance comes in and takes care of those lengthy hospital stays. Obviously, we all knock on wood here, hope that, you know, you're like my grandfather. He died in his sleep when he was 93. And there's probably no better way to go. You know, he never really had to spend a day of life in the hospital. You know, he lived a long life. I mean, in my opinion, he hit the lottery, right? 10 times over. You know, you were able to live and see all your children grow up. He never had to see any of his children die. He did have to live without his wife for a while, who passed away about 15 years before he did, but he died in his sleep. There's really no better way to go, right? Commercial insurance, medical insurance, similar to community-based. However, patients and employers purchase these insurance policies from private, often for-profit companies, as opposed to some other options that are not for-profit, which are a little bit different. Really not a lot to see here with this. Self-insurance, medical insurance coverage is provided by an employer. Employer undertakes risk paying employees' medical expenses out of its own funds directly. Risk and cost savings justified if employer has sufficient resources to cover large numbers of employees in better health than the overall population. So, yeah, I kind of see a lot of silicon companies having this kind of insurance, right? All these kind of health nuts, oatmeal eating kind of folks in that area of the country. You know, they're also very wealthy companies. You know, they can afford that risk. They can, you know, it's not as much of a risk for other types of companies, but that's an example of self-insurance. All right, so now we're going to get into something that we all know about. We all probably heard of HMOs, right? Health Maintenance Organization. Organization providing health insurance by coordinating services with specific doctors and hospitals and other healthcare providers. So notice that, folks, that's specific. If employer with 25 or more employees offers traditional healthcare insurance under the Health Maintenance Organization Act of 1973, employer must also offer an HMO. And HMO doctors and other healthcare providers agree to render services according to the HMO guidelines. Patient selects a primary care physician who tends to routine health care. If patient needs specialist, obtains an HMO referral. In other words, if they have to go outside of that network of the HMO, they get a referral and then they're able to, you know, go get that specific specialist need. So if you get questions that talk about selects primary care physician, you know, let's see here. It's coordinating services. You know, they're talking about HMOs. So just keep that in your head. If you get a question talking about primary care physicians and coordinating services, you now know that they're talking about the Health Maintenance Organization. All right, Medicare. I know we've all heard of this. This is kind of a political hot button term, right? Medicaid is as well, but federal program that pays for specific healthcare expenses for individuals over 65 years of age. So obviously Medicare is kind of dry. In a lot of ways, I've heard some rumors about it. You know, it's a tough thing to kind of keep subsidized, right? Because as health and medical science improves, we have a lot more people living beyond the age of 65, right? You go back 100 years, what percent of the population was over 65? Probably a smaller percentage, right? Now on the pie chart, the majority of people, I believe, are over 65, or that piece of the pie chart has increased exponentially because medical science is, you know, where people are living longer. You know, people are allowed to stay alive longer, dealing with all kinds of dreaded diseases or other type of injuries or ailments because of medical science. So Medicare is an ever-growing entity, if you will. Available to persons with disabilities and certain other individuals. It's divided into 4 parts. Part A covers hospital bills. Part B covers both physicians' fees and bills for medically necessary medical devices. Part C provides an option to choose from a variety of supplemental healthcare plans. And then Part D covers prescription drugs. Make sure you guys know the difference of these. I would be willing to bet that there's going to be a question that kind of break down the differences or what Part A, Part B, and Part C and Part D does. Obviously, there are gaps between them of coverage, and it's something called Medigap. It's patients often elect to purchase Medigap supplemental insurance covering the difference between the expenses reimbursed by Medicare and the total amount charged. So again, no parts A, B, C, and D of Medicare, and you should be good there. Medicare donut hole refers to the difference between expenses, as I was just saying, and then Medigap, this is supplemental insurance covering the difference. About 15% of U.S. population is covered under Medicare and growing as population ages, right? So as I was just saying, that's a substantial piece of the pie chart of people, right? You've got probably children, young adults, middle-aged adults, breaking down this 15% piece of the pie chart is ever growing, right? So again, that's your Medicare. Again, know those parts A, B, and C, and D, the basic term of Medigap, and you'll be good with Medicare. All right, Medicaid, this is for folks that have low incomes, right? Federal healthcare program for individuals and families with low incomes. Funded jointly by both federal and state governments, administered by states, approximately 17% of U.S. population is covered by Medicaid. So again, this is that, for lack of better terms, free service. If you're unfortunate to not make enough money and you qualify, you can qualify for Medicaid. I do not mind saying, when my wife and I first started out, had our first child, we were on Medicaid. In fact, I'm proud to say it. We were both in college trying to get our, our careers and education together. And so we were on Medicaid. And I don't mind saying that. It's not a shameful thing. It's, in a lot of ways, we're fortunate that we live in a country that can provide such a thing. Health-related employee benefits. So a lot of times when you get a good job, a lot of that will be dependent on the type of benefits they offer, right? Companies like Microsoft, Amazon, these companies, and BMW in our local area have unbelievable employee benefits. Something called cafeteria plans, and just as they suggest, you can take and choose what you want, right? Benefits selected by an employee from a specific amount of money allocated for this purpose and available benefit choices. Most common health benefits include medical insurance, which we just talked about a lot of that, family plans, which are like, for example, we're on my wife's insurance family plan because it's so much better. I'm self-employed, and obviously we don't have great healthcare plans. We're such a small company, but disability insurance, dental insurance, vision insurance, and group life insurance. All of these kind of become a big part of the package. Obviously, they offer vacation time, sick leave, and all these other things as well. Medical insurance includes community-based, major medical, commercial insurance, self-insurance, and HMO, all the things we just talked about. Something called COBRA. So if you lost your job and you can still, due to this, the Consolidated Omnibus Budget Reconciliation Act of 1985, COBRA, you can keep your insurance with your former employer, but you have to pay the full premium or up to 102% of the planned cost. Several years ago, my wife lost her job due to cutbacks, and we can, contacted COBRA about paying the premium, folks. It was outrageous. In fact, I think there's a joke on Family Guy about we can get COBRA. We got to pay $5,000 blah 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 whatever dollars a month. It is outrageous. To me, I don't see any benefit to Consolidated Omnibus Budget Reconciliation Act of 1985 unless you're one of those individuals that make over $150,000, $200,000 a year. It's super expensive. Personal experience there. Provides employees and their families who's lost employment right to continued group health benefits for a specific period. Employees may be required to pay entire premium up to 102% of planned costs. It's nuts how expensive it is. So family plans. Employer may elect to procure a family medical plan providing coverage to employee's spouse, children, and other dependents. That's exactly the one my wife has for our family. Frequently, coverage between two working spouses who are both covered is coordinated with insurances and known as a coordination of benefits. In other words, so you don't have overlap, right? All right, disability provides supplemental income for lost wages due to illness or accident preventing employee from working. I have a nephew who has cerebral palsy. Although he works, I believe he still gets a disability payment. But I think there's some sort of mathematical equation. If you work, what percentage of the check can you get, et cetera. I mean, some people are fully disabled, right? And that's their only form of income. But disability may be long-term or short-term, permanent or temporary, as we can imagine. Benefits usually provided on a monthly basis to allow employee to maintain standard of living while paying customary expenses at times required by state. So yeah, if for whatever reason you become disabled, there are insurances that help, pay you. And there's also like federal programs as well. So dental insurance, won't get into this. We all know what this is. Usually covers procedures such as cleanings, fillings, root canals, etc., up to a specified dollar amount, usually about $1,000. Major surgery is generally covered under other forms of medical insurance rather than dental insurance. So if you have to have some sort of oral surgery, that's probably not going to be covered in your dental insurance plan. However, if you need a root canal or you got to have a filling, this is going to be your dental insurance plan. Vision insurance, again, usually covers eye exams, corrective lenses, and contact lenses. Employees are covered for each of these up to a specified dollar amount. Major eye surgery, again, is covered other forms of insurance rather than your vision insurance. And your vision and your dental, these insurances for your like kind of routine vision and dental needs, right? You need major surgery, you're going to, elect to use another form of your insurance. Group life insurance covers employees, beneficiaries for loss of life. Coverage may extend to other events such as critical or terminal illness. Premiums for group life insurance are relatively inexpensive, and coverage is usually for 1 or 2 times employee salary. Approximately 95% of employees with cafeteria benefits select group life insurance coverage as part of employee benefits package. I have a life insurance policy that I've been paying on for a few years, and I'm sure maybe some of you as well. So definitely can become useful if you were to pass away. All right. Patient Protection and Affordable Care Act of 2010. Patient Protection and Affordable Care Act 2010, also known as Obamacare or Affordable Care Act, federal law mandating all citizens and legal residents have minimal essential health insurance coverage. Part of this was to force people to get, health insurance so they weren't going broke. I mean, families are ruined by medical coverage in this country. It's so expensive. And it was also a part of preventative stuff too, right? There's a lot of benefits to having everybody on some sort of healthcare plan. A lot of people avoid the doctor because they don't have insurance. They don't want to go broke, right? And other people like myself, I just never go to the doctor. I'll go to the doctor when my arm's falling off, so to speak. The law has been highly controversial, with many sections changed or repealed by Congress in recent years. Others have been ruled illegal by courts. So a lot of this has been rolled back from when Barack Obama was our president, right? Donald Trump pulled a lot of stuff back. Local courts pulled a lot of stuff back. I mean, I don't know where you stand politically, but I think the idea of Obamacare is a great idea in its inception, but sometimes, like communism was a great idea, in its application, it doesn't always work out. So depending on how you view it, it's a good thing. There's no doubt it's a good thing, but the application of it can be difficult. Formal individual mandate penalty repealed by Congress. Financial hardships or religious convictions exempt. States allowed option to establish health insurance exchanges where individuals purchase policies, compare premiums and features, federal exchange for states without. Same premiums to all of same age and location, no pre-existing conditions, which is a huge thing. Pre-existing conditions can cause your premiums to go way up. This was a great aspect of Obamacare. It did not matter about or not in all terms, but in this case, it might have. But and pre-existing conditions is a huge part of health insurance. No annual and lifetime benefit caps. Group health insurance plans provide coverage for dependents until age 26. Businesses of 50 or more must provide health insurance or pay $2,000 fee per employee to government. Law administered by the IRS, which kind of makes sense, I guess. But yeah, that's Obamacare. Health Insurance Portability and Accountability Act of 1996, privacy rule. Obviously, folks, when this rule came about, now you see all these degrees like healthcare management, data management, right? The Greenville Tech offers one of them or two of them. And it's actually a pretty good paying job because you've got to be licensed to handle healthcare information. It's a very protected set of data, right? Federal law providing an individual with portability and privacy rights in their health records and limits on who is permitted to view and receive health information. Again, that's where that license comes about. In other words, this law and this agency, if you will, administrative law, created an economy around how do I say this? An education and a career. I mean, because this came about, now people are getting degrees in handling healthcare information and making wages off of it. So pretty neat there. So it contains provisions related to patients' privacy. Individuals have a right to view and receive copy of medical records and have errors corrected. Medical information may be used and shared for certain purposes. Under certain guidelines, it would make sense. Excuse me. Health Insurance Portability and Accountability Act of 1996, HIPAA privacy rule. Medical information may be shared without patient's consent for purpose of treating patient, which makes good sense. Coordinating care with providers, again, makes good sense. Arranging for payments to providers, that's a necessary evil. Protecting public health makes good sense. Reporting to police and other authorities under certain circumstances, without a doubt, makes good sense. And obviously, court orders. The book provides some great examples of all of these terms and concepts discussed in this chapter. So anyway, folks, that's chapter 38. That's our final lecture of this 2022 spring semester Business 121 course. If you have any questions, please do not hesitate to reach out. To be counted present for this class, just send me an email saying you watched the lecture and we'll be all good to go. That being said, I wish all of you luck, and I'll talk to you on Thursday for our Thursday's short discussion. Thank you, folks.